Berry County Substance Abuse Task Force, and Julie Nakfoor-Pratt, Berry County Prosecuting Attorney, here to speak today about local substance use data, emerging drug trends, as well as youth access to substances with an emphasis on marijuana and vaping. So we have a lot to cover this morning. My name is Kim Metzger. I'm the Executive Director of the Family Support Center, and again, I'd like to say welcome. I would like to offer us a prayer this morning before we get started on our breakfast, and then we'll get right to our topic of conversation, because I know that we have lots of questions that we brought with us this morning. So if you would all just please pray with me. Gracious, holy God, on this beautiful spring morning, finally a beautiful spring morning, we're so grateful. We're so grateful that we can gather together this morning and eat in this abundance, and we ask that you be with those that aren't able to be with us this morning, that aren't able to have a nourishing breakfast this morning, and that we carry you in our hearts in all that we do. Lord, we thank you for the collaboration that brings us together for this event and how everybody's just rolled up their sleeves and worked together. Lord, nourish and strengthen us for the many tasks that you lay before our feet, the energy that we need to get those tasks done, and the resilience and the ability to let go of the tasks that we think we need to do, but we don't have to do. All of this, in your name we pray. Amen. All right, so we'll just start with the back tables, and we're going to go both ways down the breakfast bar, and you can fix your plates. Hope you enjoy breakfast.
All right.
And log in through the Kahoot app or kahoot.it and join our quiz, because we're going to take a quiz this morning complete with prizes. And if I can get my lovely volunteers at this table to hold up the prizes, we have a choice of sugar-filled and gluten-free. So the gluten-free are plastic, but they're still gluten-free. So we'll be starting the Kahoot shortly. Really professional this morning, so let me say this. I can't promise the professional part. What I can promise is that both Julie and I feel, we'll introduce ourselves in a second, but both Julie and I are feeling some exhaustion about the topic of marijuana and some of the current drug trends that we're facing. And so in order to spruce things up a bit, we're going to come at it from a little bit of a different perspective today. Steve Hope is in the audience, and he always reminds me that I am going to have to find a new way to do my job. And after 29 years working in the field of substance use and behavioral health, he's right. Our landscape has changed, and we have got to find a new way to communicate about substances such as marijuana. So we're going to talk about that quite a bit today, but we are going to talk about other things that we see as a problem too. So, Julie, do you want to introduce yourself?
Good morning, everyone. I am Julie Nakfoor-Pratt. I'm a prosecutor here in Berry County, and Liz hit the nail right on the head. We are, in one way, kind of exhausted. We have a guy that works at the Prosecutors Association named Ken Stecker, who's amazing when it comes to talking about this stuff, but he's tired. I mean, between the medical marijuana and the recreational marijuana laws coming down. So Liz and I will take any opportunity that we can get to talk about it, if for no other reason than to get other people talking about it. So that's what we're here for.
So we're going to take a little quiz, and you'll have to bear with us with some of the technology things today. And here we go. We're going to start our quiz. And just so you know, you're going to choose on your smartphone. You will press the touch screen in the place where you think is the answer. Marijuana is natural, fiction or reality? So we tricked you because the answer is both of them are correct. So So you all are winners, and you all get a trophy for that. No, just kidding. I don't mean it like that. But what I do want to say is it is natural. It also is not natural, because it's no longer, cannabis is no longer a naturally growing plant that exists in nature, and it is not indigenous to many parts of the world. And the way in which cannabis is being raised today is, it's a cash crop, correct? It's being used with pesticides, herbicides, fungicides, all sorts of chemicals. And as you know, hybridization and growing procedures have changed some of the structure to increase the potency of one cannabinoid and not the others. So you would have been correct either way you answered it. And we'll go on to the next question. Let's see who's in the lead right now. By the way, I should have told my staff they couldn't play. So you guys better throw it off. Okay, Tony, did you have a question?
No, he's playing.
All right, here we go.
Yeah, that's me.
All right, here's our next question. So we've got John, Christina, Spartan 86, Mo Money, and Justina looking like they're in a good spot. Here's our next question. Medical marijuana is prescribed by a doctor. Fiction or reality?
Okay, 10 of you got that correct. So this is an educational moment. You're all going to learn something new if you didn't know already. Medical marijuana is not prescribed by a doctor. There is no prescription filled out in the state of Michigan or anywhere in the United States because of federal laws. In the state of Michigan, medical marijuana is a certification. People initiate the certification process. There is a physician involved that signs off on that. That certification request is mailed to the Michigan Department of, it's mailed to Lara, correct? And Lara then approves that certification and sends you a card in the mail. It has nothing to do with being prescribed an actual medication by a physician. So I'm glad we had this opportunity. Let's see who's in the lead.
Maybe I should touch the mouse. Yes, somebody threw more money out. All right, here we go. Do you think one of you can help me with this? Okay, marijuana is legal.
Yes.
Can you guys hear me okay, or do you need us to have the mic? Are we good? Thumbs up if you're good. If I need to grab the mic, I will. Okay. So, 19 of you got it correct in Michigan, but only if you're 21 or older. I can tell you that right now, everybody in the state of Michigan just thinks it's legal. Are you aware of any situations where it is not legal? Recreational marijuana is legal in the state of Michigan, but what are some of the situations in which it is not legal?
Under 21.
Under 21, thanks, Lori. Where else?
What about in your car?
It's gotta be locked up.
Driving, okay? So if you're in your vehicle, this is one of these things that the state of Michigan is figuring out as we speak. Can it be in a vehicle? Or if it's in a vehicle, how does it have to be secured? So there are some intricacies there. How about at a school? Public places?
Yeah, can you smoke outside this building on the front steps?
No.
Okay. So remember, when things are legal, and this seems to be one of the things that people, it's a little bit like the wild, wild west out there, that we think it's legal, fair game. The law is so new that literally it's being hashed out by a task force that meets
in Lansing with many legal authorities on that board, and they can't even agree on some of the things. And in particular, there's some situations where people under the age of 21, it's illegal for them, but it's still, it's going to be kind of interesting how this all carries out. So tune in a year from now when we know more. I mean, you want to speak more on that?
Well, I think probably one of the more controversial issues is if you're driving under the influence of marijuana, before the law became, before marijuana became legal, any amount was enough. But now, that's really up in the air. Yeah. I mean, we have to, because the problem is with alcohol, you can take a breathalyzer and measure what's in your system. That's great, so let's just say they come up with something with marijuana, and I think they're talking about a strip or something you can put on a tongue, but the problem with that is there are some people who have, just like alcohol, can have a high level in their system because they smoke it a lot or they use it a lot, and maybe they're not drunk. So today, we mainly lean towards when they're visibly impaired, and we've had a few. We've had a death this year from somebody under marijuana.
So let's see who's in the lead. Jen, all right. Okay, let's take our next question.
They're all the same.
Well, they're quick at the draw. The chemical in marijuana that causes the high is... How many people have used Kahoot before? Never. Awesome. Okay, there were 2 correct answers. If you pushed, and everybody got it right. So we had one chemistry major in the room. Anybody want to own up to that? Wow. All right. And more commonly, we are hearing it called THC. And so this is the cannabinoid in cannabis that causes the change in how the brain thinks, feels, acts, behaves, perceives, all those things. So let's go to see who's in the lead. All right. And then let's go ahead and hit the next question. What's the risk of addiction if someone does use marijuana? We tricked you again. Either the blue answer or the yellow answer is correct. And I was having a conversation with Rich before this presentation. Data science and math should be our friend, right? Everything we do. How many of you work in a field where data science and math helps you do your job? All of us. All of us. We have to look at numbers. We have to look at rates. We have to look at percentages. We have to look at how many people are on our caseload, how many moved to completion, how many fell out. We have to look at a lot of data science and math to tell if we're being effective, safe, efficient, all those things. The one thing about data science and math and marijuana is people tend not to want to believe it. They question it. If the government is involved in a study, then it's a lot of different perceptions about the data science and math behind cannabis. There's also not a lot of it. So there used to be a lot more information, but it wasn't necessarily backed up by data science and math. So we now know that some of the recent research has shown that 1 out of 10 people who initiate use or keep using will likely develop that brain chemistry disease called addiction. We also know that people under the age of 18 are at a much higher risk, so 1 out of 6 who initiate use under the age of 18. So you've got quite an increase there. And this is actually from the National Institute on Drug Abuse and National Institute for Health, so based on some of their research studies. So, okay, let's take a look and see who's in the lead. Okay, I did not give them the answers. And let's go ahead and hit next.
No, other than what I've already said.
So I read my news feed on social media every morning. Anybody else do that? No? Okay. So this morning on WWMT's news feed was an article about some of the changes that law enforcement are seeing due to marijuana and recreational legalization. And one of them that's increasing across West Michigan is instances of impaired driving under the influence of cannabis, and then also driving while intoxicated, or OUID, and that drug would be marijuana or THC. So this is something that the other states who have legalized recreational have also seen an increase in. So they may not see, they're not seeing an increase in the possession charges because it's no longer illegal. But the comments, so once it's on social media, there was 108 comments this morning, and I read about 16 of them, and basically most people believe that driving under the influence of marijuana is safe. That is what public consensus is. So let's take a look at the next, or who's leading. Oh, and let's go ahead and hit next. You guys are quick. All right. So we just don't know. We don't know if THC edibles are safe. We don't know if CBD edibles are safe. We are hearing incidences, and I just heard one this morning. I hope you don't mind if I talk about it, but people are testing positive for THC on urine screens, and they are not using any THC. They're not smoking any marijuana, but they may be using CBD oils. They may be using CBD-infused candies. And because of the nature of all this, it's all connected, it is possible to test positive for THC. If you have a safety-sensitive job, and you're working in a field where random urine screens or the workplace requires that level of safety, CBD may not be safe for some people. So we just have to talk about that this carries real risks. I know a lot of you are hearing about potency concerns when it comes to THC. Nobody eats one gummy bear, right? One gummy bear may be 2 doses of the recommended amount of THC. And remember, there's no doctor involved in this, or there's no Food and Drug Administration involved. So this really is a question of, we just don't know. And everybody is going to react very differently to these compounds, and we don't know what we're buying, because it could be, say it's CBD, or it could be THC. Anything you want to add, Julie?
Yeah, it's, some are asking, is that correct, and that they are considered safe? So the answer is, it is reality. They're considered safe.
It doesn't say considered, it says are.
Yes,
So is that the key word?
I think I got this one wrong.
you did. You did.
Oh!
Everybody gets a prize.
Everybody gets a prize.
You know what?
happen?
You know what though, Liz? I do want to add though. I agree that, yeah, but
So I messed up. I'm human, sorry.
They are allowed. Edibles are allowed. So here's the problem. I think, and I'm going to go on a limb saying this because I'm not a proponent of recreational marijuana, but I also feel like, hey, it's legal. So as long as people stay within the limits of the law, we're all good. But if they start breaking the law, then we got to do something about it. I feel the same way about other things. But the problem is the way people use edibles. That's what we're seeing. I had a case early on here when I first started, and this is before edibles became legal, where some kids got a hold of Grandma and Grandpa's cookies.
Oh, no.
So with the situation of whether or not they should have had the cookies in the first place notwithstanding, the reaction on these kids, you guys, was not good. They were 10. I'm going to say average age was 10. I think there was 3 kids. And, I mean, it was bad. So in that particular situation, yeah, they're not safe. They're not safe at all for kids. And unfortunately, they got to them. They look like cookies. So, yeah. But on the other hand, anything that you use within the limits of the law or in moderation, what I get worried about, and what I've actually told my kids, because, you know, they were in school or in college, I get so worried that they're going to eat something and not know what's in it. You know, they're just not going to understand what's in it. And if they think that the label says something and that's what it is, The one time I would be really nervous about that is with marijuana, because we're seeing way too many trends of things being laced.
Yes.
And people not understanding that if you take a little bit and it's not doing anything for you, you're gonna take some more, and then pretty soon, that first piece that you ate is gonna catch up with you. That's what Liz and I have learned over and over and
And
over.
I apologize for the error. We're trying to figure out how that happened, and it's got to be operator error, which would be me, so I
Maybe you should get
apologize.
an extra point.
Yes, yes, let's go ahead to the next one. Let's see what happened here. Oh, it still didn't mess things up. Okay, next one. All right, which statement is fiction? Remember, you're looking for the one that is fiction. Patience. Patience, young Jedi.
Can you see?
All right. So, the statement that is fiction,
No, there's a virus there.
the one that is, oh, we're working with the screen. We can't see what we're doing. I don't know if you guys know that. Okay. So the one that's fiction is actually the blue one. The FDA and the USDA do not consider CBD as generally regarded as safe. So right now, nobody has said that CBD-infused food or drink is considered safe for human consumption. So that's something that we're making sure people understand, that it's kind of like the essential oil craze. You're really putting yourself out there when you ingest some of these things, because again, you don't know their content. So THC is increasing. Cannabis affects people differently. And then most importantly, many of you now know that children in the state of Michigan can be certified for medical marijuana. And at one point, I think Ken said the youngest patient was at age 5.
I was just gonna ask if he's mentioned a minimum age.
I don't think there's very many, but it is legal for children to be certified. Okay, let's see what we got here. All right, Christina's on the board. Let's see our next question.
My phone's too slow.
Okay, good. So we often will be out and about at places like Family Video, who now sell CBD. Have you been in there to take a look at their products? They have a nice little, I brought it with me, but they have a nice little handout that you can get, and it says that they're certified, what does that one say? That it's tested. Really and truly, there may be some third-party testing out there. There is, under the Medical Marijuana Licensing Facilities Licensing Act, there are quality assurance centers that will be set up. Those may be in place, but at this point that system is not 100% up and running. The USDA and the FDA have no regulation or testing over these. And as my staff will tell you, that if you want to know if something has truly been third-party tested, they should have a laboratory spec sheet that they can provide to you. Anybody could make one of those, I suppose. So again, it's just kind of an area where we don't really know what we're getting, who's making it, what's the quality control, what's the content, what's in place to make sure we're buying what we say we're buying. When we buy a can of Coke in Georgia, we know that can of Coke is the same as in Alaska, as in, theoretically, Hastings, Michigan, right? Or the world over. There might be slightly different changes, but we know that that's regulated. This is an unregulated, largely unregulated market. Anything you want to say?
No.
Okay. All right, our last question. Let's see who's in the lead. Tina. All right. And let's take our last question. answer is yep. It's a highly contested yep, because we tend to think of overdoses as a serious medical emergency. We tend to think of them as the opioid crisis. We tend to think of them as loss of consciousness, not breathing, and maybe even a fatal overdose, correct? But we're talking about a different substance. THC, cannabis, is not an opiate. It is not a benzodiazepine. It is not alcohol. So it's going to affect people differently. And the signs of overconsumption or the body not being able to handle the amount that it has consumed are going to be different. Some places will call it a green out. This is, if you get back to your office or your home computer today and you type in green out, a lot of websites will come up that are user websites, and they'll talk about how to avoid green out or what to do if you have a green out, but none of them are really scientifically based, and so we're not sharing that information here today. But it is emergency room visits due to overconsumption or the effects are becoming more common. Acute psychosis, acute paranoia, acute discomfort, perhaps feeling uncomfortable in your own body, just maybe even being completely sluggish, unable to process thoughts and activities. Those are some of the things that emergency rooms are seeing. Additionally, and this is not considered overdose, but have you heard about, and I'm going to get it wrong, cannabis hyperemesis syndrome? Is that right? Have you heard about that? So this is actually recognized by medical professionals now, and emergency rooms are seeing this. And this is where a person has consumed chronically or large amounts, is a daily user. They will develop intense nausea and vomiting, and the only thing that seems to bring comfort is hot, intensely hot showers, repeatedly. They are coming to the emergency room or to their healthcare provider with this great discomfort, and then they're finding out that yes, they are consuming usually high potency THC at larger amounts. It will go away, and if they are to go back using, it will most definitely come back at some point. So this is an interesting thing. If you like to read scientific articles, go ahead and search for it. Cannabis hyperemesis syndrome. I might not exactly have that right, but you'll get the...
How do you spell it?
All right, let's see who won. Justina, come on up. You got a choice of prizes here. I personally like the red, white, and blue necklace that lights up. My other personal favorite is the duck clips, because ducks make you happy. So have a choice, Tina. And then if you are Amy or Jen, come on up. And then, do we know who our other winners are? Let's get results and see. Kayla and Spartan 86, who are you? Go ahead, choose. Who's Kayla and who's Spartan? Oh!
I am not Kayla.
All right, go ahead, choose. I'm gonna open it up to questions because we do have to transition to the PowerPoint now. So if you have any questions, Julie will field them.
You know, they talk about secondhand smoke, but how about secondhand marijuana?
I think Ken Stecker, so we rely a lot on him because he's the one that's kind of the one that runs around the state and does all of that. I think what they have talked about is that secondhand smoke does not make kids or people around it addicted, so to speak, and I don't believe it makes them high. If somebody has something else on that, let me know, because I don't, that's what I
It just irritates them.
I mean, secondhand smoke, I think, for a cigarette, we do have a lot of studies on that, but for marijuana, this is what I think. Do you agree, Liz, that that's what Ken has told us?
Contact buzz is likely not anything to worry about. We are getting some concern about secondhand exposure with children, like in small enclosed spaces. It's not, a lot of times we compare it to tobacco. Nobody's really studying secondhand smoke exposure. I think we'll see more of that soon. Yeah, we did, my staff, we put together something for the for a school system. They had asked for some information. We do have a document that has some information, and if you reach out to us, we'll email it to you. Inconclusive, we're learning more, right? But the old, I'm going to get a contact buzz from your secondhand smoke in the Cheech and Chong days is probably not anything we have to worry about. But that probably is not, I mean, that might be an excuse that people use, right? I was in a car with my buddies. Yes. Kim, did you have a question?
I just wanted to ask, I thought that there was some studies that they have proven that there is THC found in secondhand smoke, and then THC is proven to be detrimental on the development of a child's brain.
Yes.
So therefore, secondhand smoke, marijuana smoke, would then be detrifying to the children.
Right. That's what we've got in that article, but I think what we were asking about is like, am I going to get high from that secondhand smoke, or is a child going to get high?
too, in the testing, if people are around that might get in their system.
And I think we're going to learn more, but we will be happy to share that document that we put together. There is kind of limited information out there. Bottom line is, smoke is never good for anybody, right?
That's right.
Right? So if you're using something where it uses the chemical process of igniting it, burning it, inhaling it into your lungs, probably not safe for other people to be around it.
Well, it's just my understanding that Ken Steckler said that nobody's going to get a buzz from secondhand smoke unless they're shotgunning it to their neighbor or they're in a phone booth. Anybody knows what one of those are. And, you got, a couple people just burning a joint in a phone booth, and maybe you'll get secondhand buzz off of that if you're in the same booth.
Right.
But yeah, if I had a nickel for every time somebody said, oh yeah, I've just been around it and I've got a buzz secondhand.
You'd be rich. Yeah. All right, so we have about 15 minutes, and our goal is to talk just briefly about some things that we maybe haven't covered through this official-looking PowerPoint. So I think we've got a clicker that works. Something. So we have already. Oh, maybe. Maybe not. I got you. Thanks, Emily. Let's give Emily a big, round of applause. We're going to kind of zip through some things. You just go ahead, keep going. On your tables, you'll see the 2018 My5 summary. We do collect lots of data on different things, and this is youth data. We know that our areas of concern with youth are alcohol, marijuana, and vaping, not necessarily in that order. So we'll share some things here. These are the emerging drug trends that we see in our county. Oh, can we go back just a second? Changing in attitudes and norms relative to marijuana, thoughts of safety, legalization of marijuana, including CBD, the opioid and heroin epidemic, providing access to Narcan, overdoses, e-cigarettes and vaping, and we never seem to get away from methamphetamine. So that is what we will try to talk about in the next 10 minutes. So this is some treatment data for 2016 through 18. You can see that the green is, and we get this data from Southwest Michigan Behavioral Health. We're able to track who receives substance abuse treatment using either state dollars or Medicaid. And we can't do that with privately funded or other insurances because it's just not available to us. But we do know, and it's always been true, that alcohol is the #1 admission for treatment for both youth and adults in Berry County. You'll see that heroin has decreased slightly since 2016, as has other opioids. The alarming trend is that purple selling lines, and this is 2016 to 2018. We're kind of back to seeing an increase in folks who are seeking treatment due to methamphetamine. It's good news for the heroin and the opiates on some level, but like all data, it doesn't provide you with a full picture. It's just a snapshot of that data. And you can see that marijuana just kind of, this has come down since the legalization and of both medical and now recreational use. So these are things that we keep our eyes on. Okay, let's see what we got here. So let's take a look at some trends, see if we've missed anything. Vaping. Vaping is the #1 concern of youth. How many have seen somebody vaping in the last 2 days? Bree and I were doing, we are all doing our required tobacco or nicotine vendor education visits across the county, and we had gone into a couple places, and a couple places they actually allow vaping in them, and so we were treated to some vape right into our face. So this is a trend. These data charts are significant because you see the blue, the orange, and the yellow lines show really nothing's happening. Nothing's much changing about alcohol or regular cigarette use, or marijuana is going up slightly, right? But vaping is that gray line that goes significantly up, and that is not good. And so this is another way to take a look at that data on the next slide. In 2016 was the first time the Michigan Profile for Healthy Use asked the question about electronic cigarette usage or vaping device usage in the past 30 days. And you can see that in 2016 to 2018, these are significant increases. This is not good. This is true across the region, it's true across the state, but Berry County in our region was the second highest county. So that's not good. You can see that in 11th grade, 19% said they had vaped in 2016, and then in 2018, 36% said they had used a vaping device in the past 30 days. What we're really concerned about is middle schools. This seems to be a middle school thing. So let's take a look at some of them. We actually brought some, when we're done, if you want to come up and have show and tell, we have a bag of vaping devices. You can come take a look at them. And this is definitely marketed towards younger people, attractive to those folks who like technology, kind of techie things, because they charge on a computer or they charge like a cell phone. All right, let's see the next slide. So two of these, one of these is actually a Juul. Does anybody know which one is the Juul? So Juul is probably one of the most popular vaping devices, and that's the far left. You have, in the center, you have things called packs, and these with the little cross on them, those are the sister product to Juul, but these are used for vaping THC extracts and oils and concentrates. And then the last one is actually a dual purpose. We haven't seen that one, but it's on the market, and I believe it's called a 7. And that one can do it all. So these are very easily concealed and hidden, and they will be charged on a computer. If you want to come up and see some of them that we have, we can show you something that looks similar. All right, so then again, another level of vaping, something we're keeping our eyes out for, is that many times people are vaping other substances in these, including THC concentrates or other drug combinations. All right, I think this is kind of review, because we did that quiz and we talked about some things, but these are some of the things that we're kind of running into. Marketing, changing perceptions about cannabis. My grandma, you know, and this isn't true, but this is what we hear. My grandma uses it because she has had hip surgery, and boy, does it make her feel better. Okay? You know, how do you argue with that? But because your grandma's using it legally and safely, what do we do about the 16-year-old who's using it or taking it to school? Confusion about the laws, misinformation. The biggest one is mistrust of information. People don't trust anything that comes from a governmental agency. People don't trust anything that maybe has .gov on the end or comes from the CDC. And then increasing access. When it is legal, you increase youth access immediately. And that's all that has to be said about that. And let's take a look at the next slide. These are, of course, our dabs, or butane hash oil. Anybody come into contact with any of this stuff out and about? Have you seen some of these products? So we went into abstract glass. Anybody in here want to admit to being an abstract glass? Bree and I. I would recommend you go in and take a look at some of the things, especially if you're doing home visits or you're working in homes with families, just so you get familiar with what some of the products may look like that are used for the consumption of some of these different cannabis products, because it's not just green leafy plant material anymore. Okay. This is a oil pen. It's a vaping device with all the different setup for being able to vape oils or concentrates. These are some of the rigs for smoking dabs and concentrates. You'll notice the butane torch in there. So they're not probably making creme brulee. This is one of my bad jokes, and now we're done with that. So, and these are for sale usually in gas stations all over the place. Okay. Next slide. This is actually showing how the dab is heated up and then consumed back through the pipe. So these are things that we might see that don't look like what we used to think of.
I just wanted to say on the dabs and the waxes and stuff, the teens are hiding it in the little the round chapstick things. So,
I took that slide out, Lori. But Emily, if you go back, do you see the little, one more. See the little silicone blue thing at the bottom and the little white? That's what Lori's talking about. So maybe the Carmex or the EOS, or they just kind of hide it in their lip balm container, but they actually sell little silicone containers that are fun and wacky, and then might be a heart or a smiley face. And so that could be someplace where waxes or dabs are being stored. Edibles, big time, coming to school. And nobody really knows how much is safe to consume. We're kind of figuring that out. When people ingest marijuana by smoking it or inhaling the vapor or the smoke, the effects are felt faster. When we ingest or we eat it, it takes longer. So because people are not feeling the effects as quickly, they may tend to overconsume some of the edibles. All right, let's take a look. And this is probably, in my work with doing student quick screens, we hear more and more about Rice Krispie treats infused with THC or brownies coming to school. Okay? Julie, anything else you want to say about the laws? Questions for Julie about the law, because I want to be mindful of people's time. We've kind of had fun and things, but...
I want to just real quick say something too, because I always call it the ripple effect. So in court we see that somebody commits a crime and they think they've only hurt the person that they offended, or they think they've only hurt themselves. But there's actually a ripple effect, a collateral effect that it has on other people. And yeah, I'm just going to give you a quick personal example. I won't say where this happened. I will tell you it was in Grand Rapids, but I went to an appointment up in Grand Rapids and got valet parking. And when I got my car back, it was wintertime and the window was open, and I thought, well, that's weird. It kind of made me mad, but I didn't say anything about it. I got in my car and I could smell marijuana. And I was furious because I not only don't smoke it, I don't condone it, and I don't support, I mean, I don't make the laws, I enforce them. So I've got no, it's not the law was passed and we're going to work within it. But for me personally, it really upset me. And if I want to go to a concert somewhere and I'm outdoors and I can smell it, whatever, I came to the concert, so I know. But when I'm having my car parked by somebody, I was really upset, and I really debated calling the place. And then I thought, it's legal. So I don't, he's not supposed to be smoking it in my car. I don't know if he did. I don't know if he smoked it next to it. I don't know if he had it on his person. So I didn't know all that stuff. I couldn't even tell you who parked my car. So I felt like I just didn't. Although Liz and I do speak to a lot of CEOs and stuff about about the zero tolerance policies at their workplaces. And, that's kind of one of the reasons. But, yeah, does anybody have any, I'm going to tell you one quick thing about the law. Medical marijuana, when a township or a municipality wants to make a decision about whether or not to have dispensaries or grows in their area, you have to opt in. So you can sit on your hands and do nothing, and people can't create a grow or they can't create an operation in your municipality unless you allow it. For recreational marijuana, you have to opt out, and I think the city of Hastings has opted out.
Yes.
Is that correct?
City of Hastings, my understanding is Yankee Springs, Rutland,
I don't know.
Thornapple,
Okay.
Village of Middleville,
Yeah.
and I believe Carlton have opted out. So what we are doing now is we're making sure that those entities that have opted out are also sending their ordinance to the state so that it can be on file. Because our understanding is if that ordinance isn't on file with Lara, they could issue a license. So kind of doing some follow-up on that. So
Yeah, And what we've tried to tell people is, we're not telling you to do it, don't do it. We're asking some of the municipalities to just maybe wait and see let the law kind of sort itself out for the next year. There's case law, there's a lot of things going to the Court of Appeals right now. There's a lot of squabbles that go on when a new law comes up, because there's just got to be a lot of kind of tweaking the law. And so I've just asked municipalities, could they at least wait and see how it all is going to shake out before they make a decision?
And we'll be available at the end too. So let's just kind of take a look at the other slides. These, I'm sad we're not going to get to watch these today, but these are some videos about marijuana, and specifically marijuana in pregnancy. How many of you have recently heard that marijuana is safe during pregnancy? There's no harm if a pregnant female uses marijuana to help her with her morning sickness or increase her appetite.
From clients.
Yeah. And there's a lot of information on the web that says it's okay. There's blogs, there's support groups, we found different things. And what SAMHSA has recently come out with is a couple messages about there can be real risk, including low birth weight, preterm delivery, even stillbirth, as well as brain development that we talked about, that it does cross the placenta and it can affect your baby's brain development. Same as with breast milk. So we're starting to see some information coming out. We're going to have an uphill curve on that, an uphill battle, because there's a lot of information on the internet or out in public domain that just says otherwise. So, and then CBD, we don't have any pictures for you, but someday we will. So you are our eyes and ears. If you see a place that's selling CBD, have a talk with the store owner. It's probably going to be a gas station, or it might be a convenience store. There are lots of places that are selling it because money to be made. Again, that third-party testing is important. And remember, nobody really is regulating it, not considered generally safest for consumption. Opioids is not going away. And then this next slide, methamphetamine is not going away. We could talk for years on this subject, and unfortunately, we will just continue to treat people and help them get as well and enter into recovery, and hope that helps them. So just take a look at our last couple slides here. If we can go back for just a second, Emily. If you've got families with young ones, just make sure that you're talking to them about that. Really, kids respond well to Tylenol and ibuprofen, and to consider those non-opioid pain medications first. And then if you need any Narcan training, Hannah, wave to us all. We can provide you training. We'll come and train you. We'd love to provide training for you. And then this is information about where you can seek treatment at Berry County Community Mental Health. And let's see, what else have we got? Are there any questions? We finished on time. That is no small feat. We will be here. If you have any questions, we'll take them now.
We did get a quick synopsis copy of the law too from Ken Stecker, so what I'm going to do is have my office, I like this one because it's the latest and greatest. I'm going to have my office scan it in, so I guess if anybody wants to write down my email, it's easy. It's just jpratt@berrycounty.org. I would be happy to send you the synopsis.
We didn't have enough copies, but we can send it to Kim, and maybe she can email it out.
Yeah.
How's that? Will that work? Will that work? Beautiful. Yes, Cheryl.
What was Ken's last name?
Stecker, S-T-E-C-K-E-R. And if you ever see that he's coming, I would encourage you. We just had him in Berry County on April 22nd. We may have him back again later this summer. So are you on the Substance Abuse Task Force email list, Cheryl? Okay, just look for it there. That's probably where you'd hear about it.
Liz, if somebody goes to buy the edibles at wherever, does it list the various chemicals in those, including THC, the levels, or no?
Yes, but we don't know. Yes, yes. So Bree and I, and we went out in 2 teams, so I don't want to talk about it like the other folks didn't go, but we went all across the county. I actually picked up some CBD gummies, and it's a beautiful package. It's professionally packaged, and it has all the things on it. A lot of marketing, you know, like GMO free and organic, and then it will say THC free. but THC-free only means that it can have up to 0.3% of THC in it and still be considered CBD. We don't know what to believe on those products because, again, nobody's approving that packaging or that content in there. But it should be on there. You may see some that have varying levels of, it might look like it was home printed on a laser printer versus it was, packaged professionally in some type of a food facility.
Yeah, so the
Yep.
trustworthiness is important.
Right. There's also a lot of stuff out there for pets that will say veterinary tested and approved. So, don't know. Other questions? So I'd like to know if we were thumbs up, thumbs middle, or just go home. Thanks, Tony. I always count on you for some good feels, Tony. All right, thank you, and we'll be here.